problem with the concept depression is that it's very, very broadly used. And we have to differentiate between somebody who has major depressive disorder, which is a neurobiochemical conditions, and which does respond to TMS, ECT, ketamine treatment, and medication. And when people recover from a major depressive episode, they feel like themselves again. So their character, their personality hasn't really changed, but there has been something changing in their whole experience and so on. And that differs from people who struggle with a serious life experience, a loss, a tragedy of something, and feel depressed. They feel down, low, sad, negative, pessimistic, angry. But there may or there may not be any neurobiochemical aspects to that. And they may or may not respond to medication. But there it is a matter of processing those really difficult feelings. With NPD, or pathological narcissism, there we have another type of sort of more organized self-negativity, which has to do with avoidance, very critical, negative attitudes, blaming others, feeling stuck or refusing to do things, but blaming it on or label it as depression. I have seen, or colleagues have also seen, numerous of patients who have been in treatment for depression with medication or TMS or whatever, and it hasn't helped because it is what we call characterological. There is an investment in negativity that is called depression, or may feel as depression, but it serves certain purposes. It's about controlling things, a way of avoiding, by saying that I am depressed, nobody can expect me to work, I am entitled to specific attention, or my family has to pay for me because I can't work, because I am depressed, and etc., etc. And there is a really important part of treatment to explore motives for self-negativity, motives for or advantages.
Secondary gains to basically...
Yes, and patients... should we call it, engage the patient's own motivation and sense of agency, that this is something they are involved in, as opposite to when you get a neurobiochemical depressed condition. And also to encourage patients to talk about life events, disappointments, losses, etc., that they in one or another way integrate in their own way of looking at themselves in negative terms.